This is Dr. Daniel Rennell. I'm a plastic surgeon. I'm here with my wife, Betsy.
Hello.
We're going to talk today about fat elimination. It is such a hot topic in the news these days. People are trying to find a way to eliminate fat without requiring surgery and anesthesia and that sort of thing. We've talked about liposuction and tickle liposuction before, which is a nice way to avoid some of the big anesthetic risks. But that's invasive. So what are the non-invasive ways of eliminating fat? You're born with all your fat cells, and they can gain size like 64 times and decrease in size, but you don't really form new fat cells. If you're very, very obese, then you do, but most people don't really form new fat cells. If you gain weight or lose weight, it's because the fat cells that you have there just get bigger and smaller. If you remove fat cells, they don't come back. That's what's great about a tummy tuck or liposuction is once you've removed fat from that area, it doesn't come back.
So what if you were to get really fat and you had a tummy tuck? You would be fat in your arms and your legs and not your tummy? Mm-hmm. Strange. Okay.
But, you know, the quote, being really fat, that's because you have fat on the inside of you. And a tummy tuck just removes the fat
layers.
that's just on the skin.
Right.
So you still have
your
that.
guts out.
Right, you still look like a cannonball. You still have the girth. So these techniques find ways to damage fat cells underneath the skin without damaging the skin. So there are low-level lasers. That's what the Zerona system is. There is freezing cryoliposuction. That's what Zeltiq is. And the thought is that if you damage the fat cell and it dies, then the body's own system of waste, eliminates the fat cells and you get rid of them just like you would any other cells that die in the body. It's a process that takes a long time. So,
like how long?
Like several months, maybe 3 or 4 months to...
With repetition and procedure?
It depends. With some procedures you don't have to repeat. Usually you do. With the Zerona, that's a real system of diet and a supplement that you take, as well as the laser system.
So Zerona is the laser.
Yeah, the Zerona is the laser. And what's always confused me is when I've looked into the wavelengths of the laser, they're not strong enough to penetrate skin. So I don't quite understand how it works. And I think a lot of people are skeptical that it's the laser itself that is making people lose weight. It may be the weight loss system that they're on in addition to that, or the supplements that they're on in addition to that.
Isn't that, I think I saw it on one of these goofy
shows.
It
looks like a spider.
Okay, no, I haven't seen it then. I saw something else in LA and they didn't say what it was. The dermatologist was doing it and they put it on this guy's love handle.
Oh, that's the Zeltiq.
Oh, that's what it is.
That's the freezing. That's the cryolipo.
Yeah, and he had like this welt on his love handle for a while, and then it sort of went away. But it's funny because it was called The Spin Crowd. It's this new show. It's a stupid show, actually. I don't like it. It's about public relations and stinks. But they showed this one.
She used to be in public relations, so she can say that.
This owner of the place has, thinks he's so vain and is, critiquing everybody's appearance, and he's really not the cat's meow himself. But on top of that, he's got these 2 disgusting love handles, and so his co-worker, vice president or whatever, said, "You know what, you're not so hot yourself. I'm making an appointment for you." And he really sold him on Zeltiq, but didn't call it by the name.
Right.
And he said, "There's this procedure," and he lied. He knew it was pain. The vice president knew it was painful, and he knew he wouldn't have a quick result. But he's like, "I just want to get this guy back because he's so nasty to all the female assistants." And so they did. They showed the Zeltiq. It's like this vacuum that they put in a rectangle shape on your sack of fat, wherever it is, and they just leave it on there, and it hurts while it's being done a lot, and it leaves this welt. It was gross.
I haven't heard that it was painful.
Oh, I mean, I don't know if this was Zeltiq. They never said it by name, but this is what they showed, and it was a freezing method.
The whole concept behind these non-invasive techniques is that you damage the fat cell, you cause it to die, and it gets eliminated. And that takes a long time, number one. Number two is, I don't know, how can you tell how many fat cells you're damaging and...
because nothing's coming out.
I mean, you don't really see the results.
Do they monitor your duties, or what do they do?
No, and so the whole other...
You can tell I'm a mother of young children.
The whole other type of fat removal is the whole liposuction thing, and there's many different liposuctions, but at least there, you see what you're taking out. It's
Right.
coming out right in front of you into a canister. You, the surgeon or whoever's doing it, can actually
should be just a plastic surgeon.
right. The person who's doing it can control exactly what areas are being sectioned, and if
Right.
not enough has come out, you go back and
Right,
take
you
some
know
more.
what you're worth. It's tangible.
Right, and so, at least in our society, although everybody doesn't want to, everybody likes non-invasive stuff, we're also into quick fixes. And
Absolutely, we are
we like to-
Americans.
yes, we like to see results right away, and so
Yes.
that's why I think that the non-invasive technologies still have a long way to go before they can come even close to giving you the quick fix or the immediate gratification of liposuction.
What's the pricing on that kind of thing, those things? Do you have any clue?
Yeah, it's like for Zeltiq, it's about $1,500 a treatment, and you'll need more than one treatment.
That's a
so
lot.
It's starting to get expensive. It's Zeltiq and Zerona. I don't mean to pick on them, and
No.
I think that works for many people. There are people
What would
who
you say
want
for
to.
someone who just has like a small patch of fat? And
I
they
would
don't
say,
want-
right, somebody who has a small patch of fat, who doesn't want to undergo anything invasive, because really these things, I don't think, they don't hurt, and they can be done quite easily. The problem is, you have to be prepared not to get the results that you want. And the before and after pictures that we're all seeing in the media, those are difficult to interpret. The
Well, you just
FDA,
never
right,
know.
when the FDA approves something, like it has approved these technologies.
Yes, they are FDA approved.
They're looking for safety. They want to make sure that you're not going to get hurt, but they're not looking at effectiveness
Efficacy.
that much, right?
Yeah, no,
Just some.
you're not
I mean,
gonna
the
get hurt.
FDA's right. The FDA will approve something. It's got to be a little effective. But what you have to do is a double-blind, placebo-controlled trial, a head-to-head trial. Zeltiq versus Tickle liposuction, or Zerona versus conventional liposuction. You know, with hundreds of people in the trial, and then a long-term follow-up, and that's how you tell whether something is effective or not. Just because something's FDA approved, and just because there are a couple good before and after pictures, doesn't mean that it's the answer for everybody. Maybe the answer for some people.